Also breaking details on the attack on State Senator Creigh Deeds. Tonight we now know that he and his son were fighting outside the family's home in Bath County when that attack happened.
Investigators say 24-year-old Gus Deeds stabbed his father, then used a rifle to commit suicide. Those autopsy results came into our newsroom within the last hour. Also just in, the state inspector general will look into the release of Gus Deeds following his mental health evaluation. He had been turned away from a facility the day before the attack. The problem? Apparently nowhere to put him. And that, once again, raises concerns about shortfalls in the state system. 10 on your side, Stephanie Harris is digging into the issues and discovered Hampton Roads in Southwest Virginia have the most difficulty getting emergency help for mental health patients who need it. Stephanie?
Yeah, Nicole, this report right here from the Office of the Inspector General found serious problems with Virginia's program for handling the mentally ill. This found that over a 3-month period in 2011, 72 people who were at risk for what they call serious harm did not get the help they needed because there were not enough psychiatric beds in the state. When Gus Deeds needed emergency mental health care, the state did not have enough beds. Those who work in the system say it happens more than you think.
We've had 3 situations in the last year that we've had to not been able to find bed space for somebody in a psychiatric facility.
Joe Sislovich is with the Community Services Board in Chesapeake, and his 3 patients are just a drop in the bucket, according to this report from the Inspector General. It revealed that while Hampton Roads in Southwest Virginia represent only 30% of the state's population, these regions accounted for 75% of failed emergency placements. The main reason the study cites, the psychiatric beds in Hampton Roads are frequently full.
Over the last 10 years, 15 years, the number of psychiatric beds in Virginia seem to be drying up.
Case in point, Chesapeake Regional Medical Center. It closed its psychiatric ward for the elderly in 2011, eliminating 24 beds. 10 on your side called all local hospitals and added up the current number of beds. It's 221. Perhaps surprisingly, Sislovich doesn't blame Chesapeake Regional for shutting down because it was losing a lot of money.
Although the hospital was full, when you compare the cost, the revenue potential for a psychiatric unit versus, say, a cardiac care unit, the money's in cardiac care, it's not in psychiatric.
That said, Sentara will add 24 new beds next month at its Virginia Beach General location. That'll help, but Sislovich says it won't solve all the problems. Protecting people like Gus Deeds, he says, will take time, money, and conversations that should have been taking place long before the tragedy in Bath County.
Why does it take a senator's son to do this? I mean, this happens in the community every day.
Now you can find a breakdown of exactly where those beds are located in Hampton Roads on wavy.com. Meantime, Sislovich said that one thing that can be done when someone gets a 48-hour temporary detention order from the court, he says, make it mandatory. He believes there will be legislation introduced to that effect in Virginia this year. Stephanie Harris, 10 on your side.